Now to the CDC's new figures on autism, showing a continuing rise in diagnoses among American children. Health Secretary Robert Kennedy Jr. planning a news conference today, calling the rise an epidemic. Chief Medical Correspondent Dr. Tara Narula is here with more. So what does this study find?
Good morning. Yes, so this was a CDC report from 14 states and Puerto Rico, and they did in fact find that the numbers were increasing slightly. So we're talking about 1 in 31 children in 2022 diagnosed with autism spectrum disorder, compared to about 1 in 36 in 2020 and 1 in 150 back in 2000. They continue to see a higher prevalence in boys compared to girls by about 3 times, a wide variety or variability between states in terms of the diagnosis. And also when we look at the risk factors, we see, a similarity, again, genetic predominance of this and also some environmental triggers.
So why are more children being diagnosed here?
Well, I think to use the word epidemic was probably not the right word according to most medical professionals in this space and advocates. We think it's really based on 3 things. One is increased awareness. So more people are aware of this. The other is improved access to screening and better screening tools. And the third would be really a change in the definition, so a broadening. So for example, in 2013, they rolled in Asperger's and some other similar conditions. So that is probably more of the reason of why we're seeing this.
Yeah, and awareness is so key. What can parents do here?
Right, so certainly the CDC has a recommendation to learn the signs and act early. And it's important because early intervention can really help kids and families thrive. And so they have a milestone tracker that you can download as an app to look at the developmental signs that a kid might be having and make sure they're on target. You can speak to your doctor, your pediatrician. You can get a referral to a specialist. Every state has an early intervention program that you can call without a referral and get access potentially to free screening and also services if your child qualifies. And if your child is over the age of 3, you can call your local public elementary school. But again, this is a spectrum, so there's some kids that are going to be more mild in terms of their services that they might need, and some that may be more severe. In fact, in this report, they found that less than 40% had some form of intellectual disability. So it really is a broad spectrum of what we see in
kids. Less than 40%?
Less than 40%, yes.
All right, Doc.
Yes.
Thank you.
Thank you.
Always got great information for us. We appreciate you. Thank you.